Unfortunately, the government's chosen not to act, which has put the public at risk. This action is designed to try and put pressure on the government to do the right thing by the public so that we can be there when they need us.
So what are you specifically striking on? Is it issues of pay, staff shortages? What else?
It's both of those, Catherine. So New South Wales per capita is 1,500 paramedics behind Queensland and Victoria. 1,500 paramedics would make a huge difference in our response times. It would make a huge difference to paramedic wellbeing. Paramedics are breaking themselves trying to prop up a system that's been broken for years. And we're struggling to keep paramedics because our pay rates aren't competitive with other states or even internationally.
How difficult was it to make the call?
Look, we put our patients first and our actions are always designed to minimise risk to our patients, and the public should be reassured that if they call an ambulance, if there's a paramedic available, of course we'll come. But at the end of the day, it wasn't difficult to make the call because patients need us. And simply speaking, we need more paramedics.
Can you describe for our viewers just how stretched the system is, particularly when you look at some of that data from the Bureau of Health, the last quarter in 2021 being the second highest call volume for any quarter in the past decade?
Look, our call volumes have been going up consistently over history. Our response times have been going up consistently for the last decade. We see bed block in hospitals resulting in, at one point, no ambulances being available in some major centres and only 8 ambulances being available in Sydney at one point. Clearly, we're under-resourced. And for anyone to say that bed block is rare shows a lack of understanding of the real world.
You mentioned before, Gary, with respect to if someone was to, over the next 5 days, call 000 for an ambulance, that an ambulance will arrive. Are you absolutely confident of that?
Unfortunately, no. But the reason that the ambulance may not arrive when they need us isn't because of the action that we're taking. Chances are it's because of decades of under-resourcing. We need extra paramedics, we need extra educators, we need extra call takers. We've needed those for a long time. And what this has shown us is that failure to invest in those resources has led to a situation where we know ambulances can't go to every call. The evidence is there.
Yeah. There's an idea out there of this alternate transport option where people who call 000 who don't need urgent care can be transported to, say, GPs or pharmacies. Is that a good idea?
Look, there are people that call for an ambulance that don't need one, and there are people that call for an ambulance that don't have any other alternative, unfortunately. The question, I suppose, is that do we have enough faith in the system and in the ambulance service and the government to put their support behind paramedics to make those calls? We've seen these sorts of initiatives in the past, and if something goes wrong, invariably paramedics are thrown to the wolves. And what paramedic is going to back themselves if there's no support by the government or by the ambulance service? And unless they stand there and publicly announce that backing, no paramedic is going to believe them. You
mentioned before, Gary, that New South Wales stands 1,500 personnel behind Queensland and Victoria. If you were to put those staffing issues aside, are the other issues facing New South Wales Ambulance a problem that is facing all jurisdictions across the country, particularly when you look at issues such as ramping?
Look, ramping's a problem around the country. South Australia's been in the news recently. It was a very large part of the election when that occurred. Ambulance services around the country are under strain because the hospital systems aren't coping, and that flows on to us. If people want paramedics when they call, then the health services around the country need to be fixed. And this is something that can't be done by diverting small numbers. This is something that needs significant investment by governments, irrespective of their political persuasion and irrespective of whether they're state or.
So finally, Gary, just how confident are you that this 5-day strike will result in a satisfactory outcome for the Paramedics Association?
I don't believe this 5-day strike is going to be the end of it. I think this is going to be an ongoing issue, and we will continue to fight this until the people of New South Wales get a service that they can be proud of. People shouldn't be paying for a service that's so underfunded and so under-resourced that they're not getting what they deserve.